This conference will now be recorded.
Okay. Yeah. And if the case of aqueous creams, it is water-based creams, the emulsion will be what kind? Aqueous creams. It is water-based cream. So what will be the type of emulsion? Just think. It is
Oil
water-based. So what will be
water in
container?
oil.
It will be
Ma'am,
no. It will be
oil in
opposite.
water.
It will be
Oil in
oil
water.
in water. Oil in.
Oil in water, ma'am.
Okay. Ah, yes, correct. And if it is oily cream, it will be water and oil. Okay, remember that. So can somebody tell me what are elixirs? Do you all remember? What were elixirs? What kind of dosage form is it? Elixir.
Elixirs are sweet aromatic preparations.
Okay, good. So that means what? Solid, liquid that you did not mention. Hmm? Who answered? Meghna? What kind of dosage form is it? Elixirs, solid, liquid?
Ma'am, liquid kind of dosage is elixir, ma'am.
Okay, fine. Now we will move on to the next part of your first chapter, that is new drug delivery system. See, whatever we have studied so far, all your tablets, capsules, or the previous liquid, these are all your conventional, normal, conventional dosage forms. So today what we are going to study is the newer or the novel drug delivery, it's also called. Here it's written as new drug delivery system. So new also means novel. So sometimes it's also known as novel. So if somebody asks you what are these tablets, capsules, or the other kind of dosage form, these are all conventional. CONVENTION. So these are the ones which are type of dosage forms or the new drug delivery systems are the following. That is, we have implants, then films and strips are there. Then we have something called as liposome drug carriers, then controlled drug delivery modules, erythrocytes, nanoparticles, and prodrugs. So now first coming to implants. So you all must have heard about dental implants and all, no? So something like that only, but instead of this is the tablets which are placed under the skin. These are not the dental implants, but a similar the way how we place the implants inside any cavity. The same way these are type of tablets which we will place under the skin. Before that, you have to perform a small surgery. So kind of small cut will be done, and in which inside this the tablets will be placed. So such that what happens is if when we place these implant, the drug will be released at a slow rate or over a prolonged period of time. It will not be initially only all the drug will be released. So over a prolonged period of time, this drug will be released, either a controlled manner. For the drug to release, what they're doing is has to be controlled by a magnet. So above this tablet, they are going to place a magnet, and the magnet is the one which is going to control either the release or it will also stop. So when everything is over, when your drug is completely released, it should close, right? So that time the magnet will stop it. So what they're going to do is normally this kind of tablets, they will be placed in the upper thigh, and incision will be made or a minor surgery will be done. Inside this, they will place this tablet. And above that, they will place the magnet. So it's made up of alnico rod magnet. Al means aluminium, nickel, and cobalt. Okay, aluminium, nickel, cobalt, rod, magnet will be there. It will be taped across the skin. So this tablet, or sometimes it's also in the form of capsule form. They again have the normal capsules you all must have seen. There is a body and a cap. So in that the drug will be there. Above that the magnet will be there. So you'll have to imagine how it is. And this magnet will be taped over the skin. So when the magnet is there, it will open the capsule and the drug will be released for a long time. So once and as soon as you remove the magnet, what will happen is it gets closed. That is the main principle. I hope it's clear. Okay, so you all have to imagine in this case. Next time I'll try showing you a picture. I had one, but that wasn't correct, I felt. So I removed it off. So is it clear what are implants? So these are nothing but tablets or any drug which can be incorporated in a placed inside your skin after a surgery, and above that this you will be placing a magnet. So this magnet will control the opening and the closing of the capsule. Okay, so when you when the magnet is still there, the capsule will be open and all the medicament or the drug will be released. And when you, as soon as you remove that magnet which is taped off the skin, the capsule will close. So that means your drug also will stop getting released. Clear? Any doubt over this? I hope it's
No,
clear.
ma'am.
If you're like, okay, yeah.
Yes, yes,
If any doubt, please do ask. Okay. Yeah. Next slide will go. I hope I'm audible because next room there is another class going on. That's why I'm not very loud, just so that you all can hear. That's it. Next, what we have is something called as a film and a strip. Okay, so you all have seen what are strips. So these are placed over the skin. That is for topical application. So on the skin they will be placed. And again, the same principle what we saw there. That for why we place it is for so that the drug gets released slowly over a prolonged period of time. So again, films and strips are again divided into three types. One is your zero order release film. Then we have something called as a buccal strip, and the third one is spray bandage. So this the first one, that is a zero order release film. It's also known as laminates, and again meant for topical application. That is over your skin. It's applied over the skin, and the drug should be released only topically into the skin. That's it. It should not go directly into the systemic circulation. If you want that, that is called something as a transdermal system. Okay, this is just for topical application. So now in this, what they're going to do is here, for example, they have given a your API or the drug is nitroglycerin. Now, nitroglycerin is used for treating any symptoms of angina when there is a chest pain in a person who has cardiac problem or the any artery disease kind of this. So if they are having these symptoms of chest pain, they use this drug called as nitroglycerin. So here what we do is first propylene glycol. These are the excipients which I use, propylene glycol along with another carbopol resin. That's a polymer. So they will mix these two things, and to that mixture they will add sodium hydroxide solution, that is NaOH solution, and it will be neutralized. So once this mixture is neutralized with NaOH, they will add 0.1% of nitroglycerin, that is your main drug. So then this whole mixture that is along with the excipients and your drug will be then placed in between the polythene sheets. The size of the sheet will be 5 by 5 centimeter, and the edges then will be sealed by heat. So you have to imagine a kind of polythene sheets into which the mixture is added, and then the edges, all the sides of the sheets will be then completely closed or sealed by heat. So this, after these sheets are then sealed by heat, they are going to place it on a pressure sensitive adhesive. So adhesive, we all know what is adhesive, glue, or it, the main role is for it to stick. So in order for it to stick to the skin, you the substance should be a little adhesive. So that's why they will place this mixture not directly onto the skin, because if you place it directly, that mixture will not stick to the skin or adhere to the skin. So you have to place it first on a pressure sensitive adhesive sheet, which is of 5 by 5, 5.5 by 5.5 centimeters, so that it sticks to the skin. So and then slowly the drug will be released. That is, the nitroglycerin will be released slowly into circulation for about 12 hours. Okay. So similarly, another example what they have given is pilocarpine films. These are also again used or prepared from acrylates and methacrylates. So these are the polymers used. In the previous case, the polymer they was used was carbopol and propylene glycol, and in the case of pilocarpine, it is acrylates and methacrylates. So pilocarpine is generally used to treat glaucoma and all, right? Okay, so the next one is a buccal strip. So as the name suggests, the strips are placed inside the buccal cavity. So convention in the dosage forms what we had was a buccal tablets were there, and also subsequent tablets are there which are placed inside the buccal cavity. So instead of that, now in tablets are now replaced with buccal strips. Okay, thin strip is placed, and how we prepare this is again a melted mixture is taken of the polymer of any carbovax, and in that they will dissolve or disperse the drug, your main ingredient. Into this molten mixture or the melted mixture, a thin or a long piece of fabric is dipped or it's immersed. So then that fabric will be what? It will be completely immersed with this carbovax as well as your drug. So after that, you're going to take this out from that mixture, and then you will cool this fabric, and then again cut it into small pieces such that it resembles a small strip. And then the strip will be placed inside your buccal cavity. It's such that it comes in contact with the buccal mucosa. So you can see in the picture how it is below the tongue there, it's placed. Then for about 15 minutes it's placed, and then later once everything has drug has been released, the buccal strip will be removed and discarded. So you don't have to ingest or anything. You're not supposed to swallow this. So once the roll is over or the function of the drug has of the strip is done over, it should be removed and then thrown out. Okay. Let me collapse this. So the dimension or the size of the strip is around 2 by 1 centimeter. So it's very small, such that it can be easily placed below the or inside the buccal cavity. So it will not cause any irritation to the patient. He will not be uncomfortable. So the size is of an optimum one. Okay. So next we'll move on to the third one, that is the spray bandage. So see, what a bandage does is when anybody gets hurt or there's any wound, usually we apply the medicament right onto the wound or a needle, and then you will completely close it with a bandage so that it stays intact. So here what they do is, it's nothing but a solution which is put or into a what do you say, we can say a spray can, and then it will be sprayed onto the place where a person is hurt, and then it will be like a film kind will be formed, and then later you can even simply wash it off with a warm water, so you will not feel there is anything over your leg or your hand where it's hurt. So there is no irritation at all, you will not feel anything, and it's like, you don't feel there's something else placed on your leg. It will be very thin invisible kind of film. So these are usually prepared again by, you're going to take the drug and add it to a polymer of lactic acid and hydride. So a solution is prepared. This 2% solution of purified lactic polymer will be taken. This will be added to chloroform, and then drug will be taken in the concentration of 0.01% to 90%. So this drug will be dissolved or dispersed in this polymer solution, which is again made in chloroform. So the whole thing is then packed into an aerosol container, which is having a suitable propellant. So the propellant which is used here is dichloro-difluoromethane. And this solution is then sprayed on, and it will be like a comfortable bandage. So if at all you want to wash it off, you can simply wash it off with warm water. It will move easily. Okay, so this is a brand which is available in the market. There is Next Care spray liquid bandage. The next type of the new drug delivery system. So far what we have seen was we have seen implants, we have seen films and strips, and the third one is liposome drug carriers. So you all can see the picture, right? Liposome phospholipid molecules are there, which is in blue. There's a head and tail. So a hydrophobic drug is there inside, and a hydrophilic drug is completely inside. There's a yellow globule shape you see, and the outside a yellow portion is a hydrophobic drug. So the outermost portion is the hydrophilic head, which is affinity to water, and the inside one is the hydrophobic, which has uh, hydrophobic and philic. I hope you all know. Philic is loving and phobic is hating type, so which does not have affinity to the water. So that the tail is hydrophobic there and the head is hydrophilic. So as we know, in our body there are many kind of carriers or several carriers which will transport the biochemicals from one part of the body to another. Example, proteins, enzymes. So now liposomes are nothing but liposomes are phospholipids. So the name itself, such LIP, that is lipids. So these are the lipids which will transport both hydrophilic as well as your hydrophobic drugs. So there are again liposomes are classified into many based on the lamels and also the size. Like large, there is small unilamellar vesicle, there is large multilamellar vesicle. Lamellas are nothing but the layers, and so that is multilamellar. Unilamellar single one vesicle, then there is again unilaminar, another one is also single one, and it's also classified based on the size. So we have large multilaminar which has many layers, we have a small single one, and we also have a large single unilaminar vesicles. So these are the types of the liposomes, and there are many more, so you all don't have to study in detail. There are again chapters only dedicated to liposomes. So in this, what we do is, inside this phospholipids, the drug will be entrapped. So in the picture, you can see how the drug is entrapped inside that lipid phospholipids. And also, it's not only small drug molecules, even the larger molecules also can be entrapped. So these are also mixed with cholesterol or any ergosterol to change the permeability of the liposomes to solute molecules. So next what we will see is the applications where all we can use this liposome drug carriers. So it's nothing but liposome drug carrier is its inside, it acts as a carrier, these liposomes. So inside the liposome, the drug will be entrapped or encapsulated, and then it will be carried to your the target organ from any one place to the other, from one part of the body to another. So the applications are, these liposome drug carriers may be used in diseases which are caused by parasites. Like for example, disease like malaria, which is caused by Plasmodium vivax and all, then tuberculosis and amoebiasis. So these are all parasite caused diseases. So these liposomes are also then used in case of what do you say, diabetes. So there is inside the liposome, the insulin will be trapped, and this is more active orally, and instead of going for the intramuscular administration of insulin, we can go for the liposome entrapped insulin. Then these liposomes are also used for transporting the functional DNA, RNA molecules into cells. Then they are also used to transport radiopharmaceuticals and immunological products like vaccines and all. Then liposomal adenomycin. So it's nothing but an anti-cancer drug. So instead of a free adenomycin, that is without a carrier, if you instead put it in a liposome, so that will have a longer duration of action. So if it was just in the form of a anti-cancer drug in the form of a tablet you had taken, and whereas when you compare with another this that is in the form of a liposome, the drug is untrapped and then given. So when you compare both, you will see that liposomal donomycin will have longer duration of action. For a long time it will act in the treatment of neoplasia. Similar way, liposome entrapped actinomycin D and nitrogen mustard are also more effective than the parent drug. So actinomycin D is also an antibiotic and is also an anti-cancer drug. So in this case also, when you instead of only the free drug being given to a patient, it will be entrapped in the form of a liposome and given, so that will show better action or longer duration of action. So nitrogen mustard is also used in not in the treatment, in the case of palliative care of care during breast cancer and all. You can give this nitrogen mustard. So next type of new drug delivery is your controlled drug delivery modules. So here again we have the drug inside a polymeric matrix. So ultimately, almost all your new drug delivery systems, the main aim is that your drug should get released slowly to the body, and it should be there in your body for a long time. It should not come out quickly, unlike the other dosage form. So it should be in a controlled and you can say a sustained release manner. The drug should be released. So the same in this also, if the drug will be embedded or enclosed within a polymeric matrix such that the drug will get released slowly to the body. So here the kind of polymeric matrices that we have used is polyethylene, silicon elastomers and cellulose esters. So these are the polymers which are used for holding the drug. So inside this the drug will be placed. So then again, after making the what is that, the complex of the drug polymer, that can be then formulated into either a tablet, capsule, or any other suitable formulation. So initially, directly, instead of formulating into a tablet, you have to first, this is the initial steps. You're supposed to make a drug polymer complex and then formulate into a tablet or a capsule. So these things, what they will do is, with the help of a laser beam, they will make a small hole or a small orifice is made, such that from the orifice or the hole, the drug will be released. So it's just, and then this drug can be released either by diffusion, osmosis, or the chemical reaction. So these controlled drug delivery molecules again can be applied to the skin on top, or if not, in the previous first one, how we have seen a minor surgery is done and it can be placed subcutaneously, or anywhere else you can place these controlled drug delivery modules, and then the drug will be released slowly. So what is the advantage is this: you need not monitor, the patient need not monitor every time whether, or like what happens in case of tablets or your normal conventional drug delivery system is there are frequencies, like see, it may be twice a day, thrice a day, and the patient may sometimes forget, so he will skip a dose. So he needs to be always like attentive that I have, and should remember that I have to take a tablet at so and so time. So if he skips, then naturally the action is reduced. So in this case, it's already placed and you don't have, there is no frequent dosage. It's only placed once, and then the drug will be released maybe for around 12 hours. Sometimes it is for continuously for 24 hours. So that is the main advantage of this drug delivery module. So there is no patient intervention. It's once it's done already, over, that's it. Okay, I hope it's clear. Now the next one, yeah. Did anybody have a doubt?
No, ma'am.
Okay, fine. I hope it was clear, the advantage over other types of dosage form. Okay, so there is no frequent administration of the drug here. So just remember that. Next one is erythrocytes, or they are also known as what? Erythrocytes are what? Well, I've already studied. What are erythrocytes?
Red blood cells.
Or your RBCs, right? And anybody remembers the lifespan of an erythrocyte? How many days does anybody remember? For biology, you all must have studied this. Then again, in the first year HAP, you will study. It's around 120 days. Okay, the lifespan is 120 days. So, like other kind of Dosage forms erythrocytes are also, used to achieve controlled release of the drug. That is, drug should be released over a prolonged period of time. So since the lifespan is so long, that is around 120 days, what we can do is, with the help of these erythrocytes, the drug can be circulated in the body for a long time. And then slowly the drug will be released into the serum. Now here, see in the image, you can see inside the erythrocyte, the drug is entrapped. It's first engulfed and then entrapped. And what we get at the end is the drug is loaded into the erythrocyte. So here, when the drug is encapsulated in the erythrocyte, the drug will slowly get leaked out of the cell over to a prolonged period of time. And wherever you want, only at a specific site also, you can send this drug. So how the resealed erythrocytes are prepared is, first you're going to put into a hypotonic solution. So anybody, what is a hypotonic solution or a medium? Hypotonic. Yashwant, can you answer?
No, ma'am.
Hypotonic. Anybody else? Sachin?
I don't know, ma'am.
Okay. Anybody else who knows? You all can volunteer and answer. So hypotonic, hypertonic. I'm sure you all must have heard this previously also. Hypotonic is where the solute concentration is low. Okay, and hyper, if it is HYPER, it is one second. Why did it come like that? Okay. Hyper means if the concentration of the solute will be more. Hypo, HYPO is the concentration of the solute is low. So in this case, what is happening is the solute concentration is low. Okay, so what will happen when you place this erythrocyte inside? The water will enter inside the erythrocyte and it will swell. So if suppose we had placed the erythrocytes into hypertonic, it would instead shrink. So now the concentration is low here. So in what will happen is this RBCs or the resealed erythrocytes will swell. So later after they swell, we will add now water or an aqueous solution of the drug will be added. So your drug is dissolved in water and that solution will be added to the hypotonic medium. So initially what had happened was the resealed erythrocytes have become swollen, they have enlarged, okay, they become big. So when you add this aqueous solution of the drug will now get into the erythrocytes through the open pores. So the pores are all there formed onto the erythrocytes. So through the small open pores, your drug will slowly enter the erythrocytes. And then later when you adjust the isotonicity, the erythrocytes will now shrink. So initially they were all big, like a balloon you can imagine. Okay, they had become big. So when you slowly added the drug solution, so through the small pores of the balloon, just imagine the drug has entered. Instead of the balloon, it's now here the erythrocytes. Okay, so when you adjust the isotonicity, what will happen is whatever the erythrocytes were initially swollen, now they will become smaller in size or they will become shrink. So when they become small, what will happen is the drug will get inside completely. It will be encapsulated inside the erythrocyte. So encapsulation is nothing but enclose also it can mean. I hope it's clear. Okay. So in that picture, you can initially remember, though it's not did not become big. So initially, the erythrocyte is placed in a hypotonic solution where it gets swollen. Then you will add the aqueous solution of the drug, which means the drug is dissolved in water. And then through the small pores of the erythrocytes, the drug will enter. And when you later adjust the the tonicity of that medium, the erythrocyte will become small and at last encapsulating the drug within them. So it's completely inside the erythrocyte. So where all we can use this erythrocyte? So you can use this In it can be used in kidney failure. There is resealed erythrocytes of urea is used in kidney failure to degrade serum urea. It's also used in case of asparaginous dependent leukemia, that is resealed erythrocytes of asparaginous is used in asparaginous dependent leukemia. It's also used in cancer therapy, that is methotrexate, adriamycin. These are all anti-cancer drugs. So instead of giving in the normal tablet form, they have put encapsulated into the erythrocyte and it has shown better result. Or it slowly the drug is being released. And also prednisolone. So resealed erythrocytes of prednisolone has also shown good result to prolong the anti-inflammatory action. But the disadvantage of these resealed erythrocytes or erythrocytes are it's very difficult. You need a lot of quantity of these erythrocytes, right? So you can it's very difficult to obtain this large quantity of these erythrocytes. So only if it is already present in test tubes and all, then you can scale up or manufacture it on a commercial scale. Only if these erythrocytes are made available in test tubes. So how these erythrocytes are also, it can also be suspended in normal saline solution, that is which contains sodium chloride for preparing injections. So you learn how you'll not be consuming it directly. So what they will be doing it, they are going to suspend these erythrocytes which contain the drug and then suspend in the normal saline solution, and then injections are prepared and administered to the patient. Next is nanoparticles. So as the name suggests, the particles are of nano size. So it is a colloidal drug delivery system and the particle size is in nanometer range. So nanometer means 10 raised to how much?
Ten raised to the power minus 9.
Yeah, very good. So minus 9. So see that is around 200 to 500 millimeter. So there are around, it becomes something 200 lakhs. How many zeros will be the 1, 2, 8 zeros will be there when you convert this millimeter into nanometer. Okay. So along with that 200, if you to the 2, if you add 8 zeros, it becomes so much nanometer. So because these particles are in the nano size, they are known as nanoparticles. So now that is this nanoparticles are the upcoming technology. If you go to any conference anyway, you will see these nanoparticles. So it's not only restricted to our pharma industry, even in other industries also has nanotechnology is the booming technology, you can say. So these are again carriers. So how we saw liposomes, so these are all carriers. Okay, so into the carrier we have to add the drug, remember. So so the system consists of a drug and a carrier which will deposit the drug at the target site. Sorry. So the examples of the carriers are here. They've used human serum albumin, then bovine serum albumin, then many other substances like gelatin, casein, and cellulose. So to these these are the carrier composition. It's made of human serum albumin and casein, etc. So what they do is here an aqueous solution of the carriers or these, for example, if we take gelatin, an aqueous solution of gelatin will be prepared and to that the drug will be mixed. So these natural micromolecules are the ones what we have seen in the uh, uh, previous line. So to that they will be adding the drug, and suppose the drug is hydrophobic, so you cannot then dissolve it in naturally water. What you will do is you're going to take a organic solvent, in that you will dissolve the drugs. If it was hydrophilic, you're going to dissolve it in aqueous solution. Aqueous means water. If it is not water soluble, you're going to dissolve it in organic solvent. It could be anything, or chloroform or alcohol, usually alcohol. It could be ethanol and all. Then after dissolving this drug into the organic solvent or water, depending on the drug, it will be then mixed with the carrier. So we have to take care that the drug should not precipitate out. should get completely dissolved. Okay. And then the system is then desolvated. Then what you will do is you're going to remove whatever solvent you have added, that the organic solvent. Just a minute. Okay, so then that organic solvent should be removed or desolvated by adding a solvent competing solute, like you can add sodium sulfate or alcohol. So ultimately what you get at the end is formation of colloidal particles, which will be in a nanometer range. So this then should be hardened, isolated and dried for storage. So they all will be in a wet form. So you're supposed to dry it, completely dry it, and then you can again disperse it if you want in aqueous system. Okay, so the applications are like it's used for fluorescent isothiocyanate, that is FITC. Nanoparticles are used to incorporate cytotoxic agents into tumor cells in cancer therapy. Then nanoparticles along with biological marker like immunoglobulins are used to target the drugs to very specific site. Then again, in nuclear medicine, 99M technetium nanoparticles are also used to study morphology, that is the shape, the blood flow, and the functions of various organs of the body. So, see, the main advantage, what one we have seen is it is released over a prolonged period of time, right? And also these particles can be targeted to the target site only. So suppose what happens is initially especially in the in cancer, you all must have seen what happens when a person undergoes chemotherapy or takes medicine and keeps losing his hair. And also these are the side effects what we have seen, right? So also along with the tumor cell, even the normal cells get affected, they get damaged. So if you incorporate or you administer these nanoparticles, it will target only the tumor cells and not the normal cells. So the normal cells will not be damaged, it will be only the tumor cells if you give in this form. Okay. And finally, the last one of the novel drug delivery system or the new drug delivery system is prodrugs. So prodrugs, again, you all must have already studied in chemistry previously. So these are nothing but the compounds which undergo biotransformation before showing desired pharmacological activity. So these compounds are nothing but prodrugs or pro agents. So prodrugs are nothing but again the same drug only, but they are either the ester or it could be an amide of a parent drug. Okay. So for example, see, under applications you can see chloramphenicol is a parent drug. Chloramphenicol palmitate will be the prodrug. So it is an ester or an amide of a parent drug member. So what the main advantage of these prodrugs are, it is if you compare with a parent drug may be not that soluble, or it may not be that stable, or it may have a bad odor or a taste. So instead, if you go for these prodrugs, they will help in improving all whatever is lacking in the parent drug. It will help in improving the solubility, the stability, then the bioavailability also of the drug, and masking the unpleasant taste and odor of the parent drug, and reducing the drug toxicity also. So if at all a person cannot feels the taste is very bad, so what they will do is in the pharma companies, they're going to go for the prodrug. So when you go for a prodrug, it will mask the taste or the odor of the parent drug. So for example, chloramphenicol palmitate. So that is the prodrug of the parent drug, chloramphenicol, and it's used in the preparation of pediatric suspension. So chloramphenicol, we do not generally use chloramphenicol as such because it has a bitter taste. So if we go for chloramphenicol palmitate, the bitter taste will be masked. So this is nothing but an antibiotic. It's used to treat bacterial infections. Second example is procaine penicillin G and benzathine penicillin G. These are again antibiotics and prodrugs of your main drug, that is penicillin G. So if we were to administer only penicillin, what would happen is it would get hydrolyzed. So procaine penicillin G is instead given, and as it shows resistance to hydrolysis. Next example is testosterone cypionate, the prodrug of testosterone, which is again long lasting in comparison to parent drugs when injected in an oil base. Okay, so testosterone is generally present in the men or the boys, but in people who do not have this hormone, we have to inject testosterone. So instead of just the parent drug, we are administering or converting into a prodrug, that is testosterone cypionate, which is again longer acting. Okay. Next one is clindamycin 2 palmitate. That is again the prodrug of clindamycin. So when you compare with the parent drug, that has no bitter taste. So clindamycin is again used to treat bacterial infections. Second one is also again clindamycin. That's another product, that is clindamycin 2 phosphate. So this will cause little pain and irritation at the site of injection when given by intramuscular route. So normally you all know whenever they give any drug by the any IM route or IV route also, it will cause a little pain and irritation. So if instead of the parent drug, if instead of clindamycin 2 phosphate is given, pain is reduced and also irritation is reduced. Okay. So next one is introduction to pharmacopoeias, which we will take in the next class. So that is coming Monday. Monday will be a holiday because it's Vijayadashmi. So I think it will be, I'll be taking the next class only on Wednesday. Okay. So for any doubts in the normal conventional dosage forms and these novel drug delivery systems?
No, ma'am.
Okay. Okay. There was one word there, bioavailability of drugs. Have you all heard that before?
No, ma'am.
Then why nobody asked
No,
a question?
ma'am.
Okay, yeah, fine. No, only it is
Bio.
bioavailability of the drug. See, bioavailability is nothing but the amount of the drug which will directly reach the systemic circulation. Your systemic circulation is nothing but the drug, sorry, the blood. Okay, see now tablets if I take and if I compare that with injections, which will directly reach, or which of the two dosage forms more amount of drug will be reaching the this systemic circulation, in tablet form or injection form?
Injection form.
Okay.
Injection.
So understood, no? So in the case of injections or your parent dress, the bioavailability will be 100%. So how much you administer, that much full amount will reach the systemic circulation. Clear? Okay, so it's the rate and the extent of the drug which will reach into the systemic circulation. Whereas your tablets will have maybe around 70 to 80% max. It can go even less. There are many drugs which when you give it, it will be again 40 to 50 and all. So instead, if you give it in a parenteral form, it is 100%. Okay, so bioavailability, remember the amount or the rate or the extent of the drug which reaches into the systemic circulation, that is bioavailability. Okay, so if you're giving in the prodrug form instead of a parent drug, again the bioavailability may be increased or improved. If that was around 50 to 60, it may go to, again it may increase to 70 to 80 by if you're giving in the form of prodrugs. Okay, clear? Can we wind up? It's 11:56. Shall we wind up? Before leaving, I just want to again clarify. Mutturaja is not there, right, today? If he's there, he just has to say yes. Okay. Siddharth Gowda also not there. Harshavardhan. Not there. The rest all are present. Correct? Anybody's? Dinesh just left. That's it. Okay. So are you all reading anything? After your classes, what do you all generally do? How do you all revise? Hello? Sindhushri?
Yes, ma'am.
Okay. How do you all revise? Has any teacher started giving notes or they have shared the PPT?
Yeah, Arvinder ma'am